Good afternoon, everyone. I'm Michelle Halyard. I'm a radiation oncologist at Mayo Clinic, and I specialize in the treatment of breast cancer. And I'm also the dean of Mayo Clinic Gallagher School of Medicine here in Arizona. And the title of my talk is Breast Cancer Realities of Coping and Survival, what every woman and man needs to know. So we're so glad that you're here to join us today. So, breast cancer impacts a lot of lives. There are new cases that are about 284,000 a year, and the vast majority of those are women. About 2,600 men are diagnosed with breast cancer every year. Within Arizona, there are close to 6,000 female breast cancer cases. The important takeaway on this slide is that men are diagnosed with breast cancer too. Many people think that this is purely a disease of women, but men can get breast cancer as well. The good news about breast cancer is that for Black and Hispanic women, the incidence of breast cancer is not higher than white women. And the survival, when we take a very arbitrary time point of 5 years, is quite good, with 80% of women of color with breast cancer being alive. It's important to note early detection is key because well over 90% of localized breast cancers, that is, cancers that have not spread to the lymph nodes or through the bloodstream, can be cured. And early stage survival in Hispanic women is equal to non Hispanic white women. Death rates are decreasing, which I think is a great statistic because many people think when you develop breast cancer that there's low chance of surviving, but there really is high chances. And with improved cures over the last decades or more, the death rates are decreasing. And equally important is that women with breast cancer can survive and thrive. The not so good news is that not everyone is doing as well. Although greater than 90% of women can beat breast cancer when it's early stage, the overall survival in Black women with breast cancer is lower. And there are a number of factors for this, including biological factors. Women who are Black have a higher risk of higher grade, which are more aggressive breast cancers, or triple negative, which are also more aggressive. There can be later stage of diagnosis and less access to high quality, timely treatment, as well as underlying illnesses, which may make survival of breast cancer less than white or Hispanic women. So, what is breast cancer? So, breast cancer is disease where cells in the breast tissue divide and grow without normal controls. And as shown here on this diagram, you can get one normal cell in the body that can turn cancerous because of changes in its genetic material, and it grows uncontrolled through tissue. Invasive breast cancer is depicted here. And as we look, this is a little cartoon of the breast, and we show ducts within the breast that that are aligned with normal cells. And these cells start to grow uncontrollably and push through the wall of the duct into the surrounding tissue where they can be picked up by lymphatics or blood vessels. Invasive ductal is one of the most common types of breast cancer that we see. So, what causes breast cancer? This is a question that's often asked. So, we know that every cell in the body has nearly 20,000 genes, and genes are the blueprints for the body, and they determine the color of everything from a person's eyes or if their hair is curly or straight. And they contain blueprints that make proteins, which are important in cell regulations. And sometimes genes don't work as they should, and we call these changes mutations. And it's these mutations that can occur in the normal breast cells that can cause cancer. So, really, cancer is a change in the genes of normal tissue, which cause them to grow uncontrollably. There are several inherited changes in genes that predispose patients to breast cancer. And the most common that we hear about are BRCA1 and 2. And this is present in anywhere from 1 in 400 to 1 in 800 people in the general public. And this accounts for the vast majority of inherited breast cancer. Only about 5 to 10% of breast cancer cases in the United States are linked to these inherited gene changes. Why is this important? I've heard many people say I'm not at risk for breast cancer because I don't have a family history, and that is a myth. Only about 5 to 10% of breast cancers are linked to these genes or family passed down through families. And so just because you don't have a family history of breast cancer does not mean that you're not at risk. There are many breast cancer risk factors besides being female and aging that can occur. We've talked about these genetic changes, and these genetic changes are ones that contribute to male breast cancer. It's important to know your family history, as we've talked about, but other factors including dense breasts, high blood estrogen levels, no children or having children late in life, being overweight or gaining a lot of weight during adulthood, drinking alcohol more than moderation, postmenopausal hormone use, first period after 20, no physical activity, and no breastfeeding have all been shown to be contributing factors to the risk of breast cancer. It doesn't mean if you have these things that you're definitely going to develop breast cancer, but they can put you at higher risk. So early detection is the key. It's the best and most effective way of preventing breast cancer death by being diagnosed early means it increases your chances of survival. And indeed, breast cancer death rates in the United States have declined 40% from 1989 to 2016. So, what's important for you to do? Know how your breasts look and feel and report changes to your care provider. It's important to know what is normal for you. We've gone away from recommending that people do monthly breast self exams to more of a strategy of knowing what your breasts look like, knowing what they feel like, and checking regularly so that if you develop any changes, you can report them to your healthcare provider. So, what are the changes that should be reported? A lump or hard knot or thickening inside of the breast or underarm that's was not there before should be reported. If you develop swelling, warmth, redness, or darkening of the breast, if you see changes in the size or shape of the breast, look at this picture here where this breast is slightly larger than the other side. And without examining yourself and knowing, you may miss this. Now, it's a change. So many women often have different size breasts. One may be a little bit larger or smaller than the other, but if it's changed, let someone know. If there's dimpling or puckering of the skin, that could be a sign of something that needs to be brought to the attention of your healthcare provider. Itchiness or scaly or soreness of the rash on the nipple, pulling of your nipple inward, a nipple discharge are all signs that should be investigated by your physician or other healthcare provider, and new pain in one spot that does not go away. Now, of course, there are other things that can cause pain in the breast, such as women who get painful breasts when they are having their period. But it's important to know if something is different. It's not just that breast cancer prevents with a lump. All of these things can be signs of breast cancer. So, in terms of screening, early detection again is the key, and screening is a key part to that. So, talk to your doctor about which screening tests are right for you and if you're at higher risk. Mammography is the gold standard for screening. The Mayo Clinic recommends that you have a mammogram every year starting at the age of 40 if you're at average risk. If you're at higher risk, such as having a mother or another first degree relative that had, for example, early onset breast cancer or both breasts had cancer, your screening may need to start earlier. The US Preventative Task Force recommends something slightly different. They recommend having mammograms every 2 years from age 50 to 74 with an individualized approach for women 40 to 49. It's important also to discuss when your physician when to stop screening. The data suggests that greater than 75 years of age may have a lower benefit of screening, but it's important to talk with your doctor. And another important take home message is that mammograms are okay even in the pandemic. Healthcare providers are taking great precautions to prevent people from getting sick coming into their offices. So please, please don't put off your mammograms in the pandemic. We do know that sometimes women had their vaccine within a few weeks of their mammogram may have some enlarged lymph nodes that show up on mammogram. So it is still important to get your mammograms. If you're going to get it, you might want to wait a month or more after your COVID vaccine, but please don't put it off indefinitely. So, mammograms are x rays where we are able to actually take a film of the breast and look inside and see if there are any changes. So, here's an example of a woman. Her breast would be where you can't see it, but these are two mammogram x ray plates. They take an x ray. And the whole mammogram obtaining is less than a half an hour, usually 15 or 20 minutes. Sometimes women are scared to have mammograms because they hear that they hurt. These plates do compress the breast. It's uncomfortable for 30 seconds or so per image, but it is well worth it. This is an example of a mammogram where, as you see the arrow, there's a little nodule here that is picked up on the radiology film and could indicate that something may need to be biopsied. So, what can you do to help lessen your chances of breast cancer? One is maintain a healthy weight, add exercise into your routine, and we recommend that you get at least 30 minutes of exercise a day most days of the week. Limit your alcohol intake to, for women, 4 ounces or less a day. Limit postmenopausal hormone use and breastfeed if you can. So, what are some of the other things that you can do? Know your risk. So, again, know your family history, get screened, and I'll, of course, share something that you're learning today with someone that you care about. I think the most important thing is if you think something is wrong or you are diagnosed with breast cancer, seek medical care and seek support. So, speaking of which, what do you do if you are diagnosed with breast cancer or a loved one is? And this section really deals with coping and survival after breast cancer diagnosis. So, the first and foremost is seek the best care that you possibly can. Go to people who know how to treat breast cancer, who have a track record, and importantly, who you have comfort with. Your breast cancer care team is a team that you have to live with for months at a time, and you need to have a good relationship with your providers. Educate yourself. Read reliable sources. There's a lot of things on the internet that really, quite frankly, are not right. There are a lot of things that will make you nervous. So it's important that you read reliable sources of information, such as Mayo Clinic's website, American Cancer Society, National Cancer Institute, Susan G. Komen Foundation, but please stay away from non reputable sites. Know the details of your cancer. What type of cancer do you have? What are some of the tests that they've run and what do they show? Understand your treatment options. None of you, or the vast majority of you out there listening to this, are physicians or cancer specialists, but yet you can understand by reading, by asking questions, and asking questions until you understand. It's important if you're diagnosed to find support, mental, emotional, and spiritual. This is sometimes a challenging time for individuals, and you need that support. Take someone with you to appointments so that they can be a second set of ears or eyes. If you can't take someone, record your visit. Ask your clinician, your healthcare provider, your oncologist, can you record what they're telling you? Because a lot of times when new information is coming at you, you're not going to remember. I don't remember everything my doctor tells me, and I'm in the healthcare field. So take someone with you, write things down, or record the visit. Separate fact from fiction. People are going to tell you a lot of stuff about breast cancer. You're going to read a lot of stuff. Make sure that what you're digesting is true and factual. And remember that everyone's cancer journey is different. The thing that I hear time after time from my patients is that everybody, albeit well intentioned, wants to give them their own journey story or the story about people that they know about cancer, and everybody's journey is different. So, if you're diagnosed, recognize that not all breast cancers are the same. There are different types of breast cancers, and therefore the treatments may be slightly different from one woman to another or one man to another. You're going to have a biopsy to make the diagnosis of breast cancer, and the findings from the biopsy are reported on a pathology report and will help guide the treatment. There are many different types of treatment, including surgery, radiation, chemotherapy, which is using drugs that circulate through the body to treat cancer cells. There's hormone therapy, which block the estrogen and progesterone female hormones circulating around in the blood, which can act as food for the breast cancer, and they help to block that. And there are other targeted therapies that can treat breast cancer. So, takeaway message that there are many different ways, and sometimes people get all of these. Sometimes people get one or maybe surgery only. We usually don't treat with radiotherapy only. That's usually additive to surgery. Patients may or may not get chemo or hormone therapy or targeted therapy depending on their own characteristics. Personalized treatment is what is carried out for each individual. So, your pathology report is going to tell you your specific type of cancer and therefore the biology of the tumor. You're going to have uh, information regarding whether it's spread to the lymph nodes or not. And it will also give you additional molecular characteristics that will help guide your therapy. The breast cancer specialists take into consideration your overall health and age as to the types of therapies that you should get. They will take into consideration other medical issues that may play a role in whether you can tolerate treatments, and of course, your personal preferences. People should work with you as a valued partner in helping to make the decision about your treatment. Again, go back, ask questions, and that helps you to come to a treatment regimen that you're comfortable with. I have to put in a plug for clinical trials. Clinical trials are an option that can be discussed with your provider at the time treatment decisions are made. Over the past 20 years or more, treatment for breast cancer has improved greatly due to clinical trials. And that's why, as I talked about before, the death rates are declining with cancer. Clinical trials test the benefits of new treatments, diagnostic methods, and screening techniques, and also ways of preventing breast cancer from recurrence. And people can volunteer to take part in research trials. Whether a new therapy or test becomes part of standard treatment, diagnosis, or screening for breast cancer can depend largely on clinical trials. So it's important. I know that we, as people of color, sometimes are skeptical to take part in clinical trials. There are many, many, many safeguards that are in place to make sure that no harm comes to patients from improperly testing. And we, as people of color, can really only make sure that our therapies that are being offered to us really do work in people that look like us if we take part in clinical trials. So let's talk a little bit about some of the common issues in breast cancer patients. They include fatigue, which can be described as a feeling of lack of energy, decreased physical strength and weakness. And you see some of the interventions here that can help with fatigue, including exercise, which is a great one. And we encourage exercise during all parts of your cancer therapy. Women can have hot flashes and their medications to take care of that, and acupuncture. You, Musculoskeletal complaints can occur. Psychological anxiety and depression are very common, and we really encourage you to seek help and support. Women can experience unhappiness with their appearance, although sometimes that will go away with time. And of course, ongoing concerns about recurrence. Relationship issues are important. Breast cancer diagnosis can impact communication amongst family members, intimacy issues, body image issues. And again, we suggest that if you're having trouble or difficulties, that you seek help, intervention, counseling. So we also know that long-term breast cancer survivors compared to non-cancer survivors can have difficulties with physical functioning, with mood, fatigue, intrusive or avoidant thoughts, and also sometimes even faith issues. We would hope that everyone turns and leans on their faith, but sometimes these types of really difficult stressors can shake your faith. Again, Reaching out, seeking help, get admitting that you're struggling is not weakness. It is something that's showing love for yourself. So, other strategies for coping, if you have symptoms, ask if there's treatment for those symptoms, because many times there are. Development of coping skills, including meditation, yoga, other practices can help. And take advantage of your clinical team members, including social workers, psychologists, and psychiatrists. Families are under much stress as well. Families living with cancer patients are vulnerable to their own burnout, to depression, anxiety. And if you're a family member or a caregiver taking care of a cancer patient, we encourage you to seek support and to take care of yourself as well. So I just wanted to talk very briefly about an organization called the Coalition of Blacks Against Breast Cancer. Here's our website, cbbcaz.org. Our goal is to help support breast cancer survivors and their family of color. Everyone is welcome to CBBC, whether you're Black or not. And this is our website. We have a full website, including resources. We have an Instagram and Facebook page, and we have a support group, and more details can be found on our website. So, with that, I'll turn it over to questions and happy to answer them.
Thank you, Doctor. If you'd like to ask a question, either raise your hand or put the question in chat. All right, I'd like to kick it off. Doctor, are men able to get breast cancer?
Yep, and as we showed on our slide, there's about 1 or 2% of men can get breast cancer. Their most common sign or symptom is a mass in the breast, and so it's important, just as it is for women to know what their body feels like, for men to do so as well. So yes, men can get breast cancer. We generally treat just the same way we do with women. We treat with surgery, and some men have a mastectomy, other men have breast conserving surgery, and radiation and chemo and other treatments are dictated by the biology. So, great question. Men can get breast cancer too. It's most commonly seen in men who have a family history of breast cancer. So, men, if you, have a mother, an aunt, a sister, many relatives that may have breast cancer or ovarian cancer or even prostate cancer, that may be a tip off that you have a family history. And it's important for you too to know that history.
I have a question. Are there different types of mammograms? And if so, is one better than the other?
Yes, there are different types of mammograms. In most all mammograms these days are what we call 3D mammograms, where they provide an image to the radiologist in uh, 3 dimensions, which helps to improve the sensitivity of the mammogram compared to the older mammograms. So most centers have those now. There are what we call contrast enhanced mammograms, where they can give a dye with the mammogram. That is typically used more for diagnostic purposes rather than a screening mammogram. Screening mammograms are those when you don't have any symptoms and we're just checking, keeping a check to make sure you haven't developed anything. Diagnostic mammograms are those types of mammograms whose purpose are for evaluating an abnormality. So sometimes we add some contrast or dye in with the mammogram to evaluate.
Thank you.
You're welcome.
All right. Thank you, Dr. Halyard. If we don't have any other questions, I think we're going to have one of the board members close us out.
Okay, thank you again, Dr. Halyard. That was a wonderful, very comprehensive presentation. And all this information will be found in our Room of Hope and Help. And the website can be found on the screen here. We appreciate everyone for attending. And thank you again, Dr. Halyard. We
Thank you
really
very
appreciate
much.
your time.
Thanks, everybody. Bye bye.
Bye. Have a good one.
You too.